This is the busiest slide in the deck, I promise. So I'll just quickly take you through pay or play penalties. So we start here. Do you have 50 full-time benefit equivalent employees? No. Penalties don't apply to small employers. You can leave. Kidding. If you have more than 50, do you offer coverage? No. And one or more employees receive a premium tax credit or a subsidy through the marketplace. Again, marketplace just changed their name to marketplace from the exchange. You must pay a penalty for not offering the coverage. I'd gather that most of you in the room are offering coverage today, so let's go to this scenario. Does your insurance pay for at least 60% of total health care expenses? No. Then if your employees can choose to buy coverage from the marketplace, and you have to pay a penalty for not offering affordable coverage or a minimum value coverage. So we're going to talk about this in the strategy section. Most organizations already do this. So if you're thinking, gosh, I don't know if we do that or not, you probably do. The second trigger is, do you offer a plan that meets the 60% threshold and is not greater than 9.5% of your employees' wages? So the contribution that you ask them to pay, is that in excess of 9.5% of their income? If it is, you're good. Or if it's below that, you're good. If it's above that, your employees can choose to buy coverage, get a tax credit, and then you're back in the penalty zone. So one of the big things we'll talk about later is just making sure that, one, your plans are affordable, and number two, meet this minimum essential benefit level of 60%. In the healthcare reform modeling that we do, this is what we uncover. You should make sure that your brokers and consultants are just running your company through a healthcare reform modeling tool that helps you understand if both of these criteria are being met. I often get this question from friends of mine who say, you know, I'm spending $10,000 per person per year on benefits. I'm just going to pay $2,000 penalty and let them go off on their own. Great. How many people are going to continue to work for you? Right? Are you in a tight labor market? If you're not in a tight labor market, it's a viable strategy. Right? If you absolutely are convinced that you can replace your employee who has partially come to work for you for the benefits that you offer with someone who is equally qualified, who is okay with buying health care insurance on their own, then it's an absolute viable strategy. But let me just take you through the math here. So if you have a $10,000 policy, and let's just say in total you pay 65% of it, the employee pays $3,500, and this $3,500 is, there's a section 125 which makes it pre-tax. And you compare that to the strategy I just mentioned, which is I'm going to take my $10,000 per employee per year, and I'm going to reduce my cost 25% off the top so I can have room for the penalty. Here's what you're not taking into consideration. So you take this $10,000 policy and you tell your employee, I'm not going to offer benefits anymore, but I'm going to give you $7,500 so you can go off to the exchange or the marketplace and buy insurance. Well, in order to give someone $7,500, you have to gross up their income. So there's $2,625 based upon 35% federal and state. And on top of that, we've got these lovely payroll taxes that have been increased now, and that's $668. And now you have to pay the $2,000 penalty to the government for the exchange. So in total, you're $6,500, right? You've got $7,500, $2,625. Now both of these are still tax deductible, but this is not tax deductible, the $2,000. It is worse for the employee, it is worse for the employer in this scenario.